Hello, my name is Kirsten, and I will be talking about the EGD procedure, or the esophagogastroduodenoscopy. That's a long word, that's why they shortened it to EGD. Anyways, so what is it? It's a diagnostic and therapeutic procedure where a doctor uses a flexible lighted scope, an endoscope, to view the esophagus, stomach, and duodenum, or the upper small intestine, to find the cause of digestive issues like heartburn, pain or difficulty swallowing, allowing for biopsies, polyp removal, or treatment of bleeding. The anatomy that is involved in this procedure is the mouth, or the oropharynx, the esophagus, stomach, and the upper small intestine, or the duodenum. How endoscopy interfaces with the EGD. An endoscopy, sorry, I always have a problem with that word for some reason. An endoscopy is the tool that is used in the EGD procedure. What position is the patient in during an EGD? Well, the patient is typically positioned on their left side, or left lateral decubitus, or bitus, I don't know how to pronounce that, with their neck flexed forward, allowing the endoscope to pass easily down their mouth, through the esophagus, stomach, and into the small intestine. What specialty equipment, instrumentation, and disposable supplies needed to perform the surgery? You will need a flexible gastroscope, a video tower, which includes light source, processor, and monitor, the patient monitoring system, anesthesia equipment, bite box, biopsy forceps, snares, cleaning brushes, suction, irrigation, and depending on what is done, clips, stents, cryotherapy for treatment. Which of these items are sterile and non-sterile? So the video towers are typically a part of the sterile aren't typically a part of the sterile field and must be kept outside the sterile field, but the camera head, light cable, and drape/adapters may enter the sterile zone. Patient monitoring systems are not sterile unless touching the patient, such as catheters, mouthpieces, oxygen masks, etc. Anesthesia equipment is considered sterile equipment because it comes in contact with the patient. And then bite blocks, biopsy forceps, snares, suction, and irrigation are all sterile equipment because they're coming into contact with the patient's skin and bodily fluids. What type of medium is used during an EGD? Doctors use air or carbon dioxide to inflate the upper digestive tract for better visualization. CO2 is preferred because it absorbs quicker, leaving the patient with less post-procedure discomfort. Which is interesting because I had a EGD done a few months ago, and the next day I was in so much pain because the CO2 did not absorb like it was supposed to, so it was still releasing from my body, and it was extremely painful. Risks and complications during an EGD. Generally, an EGD is safe, but some risks include bleeding, perforation or tearing, reactions to sedation. Some more serious issues are hemorrhaging, which is rare unless removing polyps or doing a biopsy, and complications with bloating, sore throat, or nausea. I didn't have the nausea, thankfully, but I did have the sore throat and bloating with it, which was not fun. Some people can also aspirate during an EGD as well, which can develop into pneumonia if not treated right away. I also had this incident happen during my EGD. I did aspirate, so the stomach acid ended up going into my lungs, and they did as much suctioning out as they could, but they still put me on antibiotics to make sure that I didn't develop pneumonia. And there we have it. That is the end of my presentation on the EGD procedure. Thank you.